Hi, this presentation is about nurses bullying each other. My name is Olivia Christian. Imagine being a new nurse, starting your new job. Everything's really exciting and you've worked really hard to get to where you're at. However, you end up being bullied and isolated instead. New grad nurses are often bullied as part of hazing by older, more experienced nurses. 60% of new nurses leave their job due to the behavior of their co-workers. What is bullying? Peer bullying in nursing is defined as repeated harmful actions done to make others feel bad. It's often motivated by a desire for dominance or insecurity or toxic workplace culture. What are the effects of bullying? The nursing shortage is worse because nurses are leaving because they're being bullied. Nurses have higher stress levels and lower confidence when they're being bullied. Nurses make more mistakes and patients feel less safe because the nurses are less confident and don't ask coworkers for help. Team communication and trust is damaged. Why do nurses bully each other? Bullying may be excused by saying it's the best way to teach new grads and it's a rite of passage. Senior nurses may feel threatened by new nurses because they're young, they have a good attitude, and they have tons of energy. In nursing, there's also tends to be a attitude that competition is better than collaboration. What's the impact on nurses' mental health? Over 90% of nurses report being overworked and not rewarded enough, which means they're already struggling and bullying adds to it. Nurses face an 18% higher risk of committing suicide than the general population. Nurses face stress, burnout, and a lack of support, as well as being harassed by other nurses. Bullying could be the breaking point for any nurse. What is the effect on patient care? Poor communication and increased mistakes lead to patients not being taken care of well, and patients distrust doctors and nurses if they don't receive quality care. According to Lewis 2023, bullying is a public health issue and not just an HR issue. So what needs to change? While hospitals can implement anti-bullying policies that are actually enforced, and they can allow reporting to be anonymous so more reporting is done, they can also train workers on how to treat co-workers respectfully and as a team. What can be done culturally? Well, leadership can model respect and encourage employees to work together rather than compete for attention and higher pay. Mentorship programs between elder nurses and younger nurses may foster friendship and collaboration. It would make new nurses seem like less of a threat. There's the sink or swim mentality. Some nurses believe that tough love makes new nurses stronger and more capable. Toxic workplaces don't make nurses stronger, just more stressed out and less confident. A mentorship program would help with this mentality by making new nurses less of a threat to older nurses. Supported nurses make less mistakes, stay at their jobs longer, and deliver better patient care. In conclusion, when nurses bully each other, it hurts staff and patients alike. Without any intervention, healthcare quality suffers and nurses leave their jobs. We have to create a safe and respectful workplace. Nurses and patients deserve to be valued and cared about. Here are my references.